Good evening, everyone, and thank you for coming back again. We've had a great time trying to really help everyone understand themselves, to begin doing research and deciding on where you'd like to have your baby, what provider you'd like to have. And with the whole idea of you being able to take more control, um, be very aware of what's happening so you can be actively engaged with informed decision making. My name is Carolyn Curtis. I'm the CEO and founder of the CARAB Company. And tonight I am delighted to have Dr. Patrick Neustatter with me tonight. I'm going to give you a little bit of his background, and I'm just really excited that he's with us. He was born and lived around London, England. He was educated at a do-as-you-like progressive school, the Dartling Hall School in Devon, England. His undergraduate training was in medicine at Guy's Hospital at London University. His postgraduate work and training was in general practice and also in anesthetics. He practiced in temporary positions in Australia, Canada, Africa, Haiti, Ecuador, and France. So he brings lots of very interesting experience to us. He's worked for 2 years as the medical editor of Medical News in London. In 1982, Dr. Neustatter moved to the US. He did his residency in family practice at the State University of New York at Stony Brook on Long Island between 1982 and 84. And then he came to Fredericksburg, Virginia in 1986. He worked as a family physician at the Pratt Medical Center in Garrisonville, Virginia for 24 years, retired in May of 2010. He's been a volunteer medical director at the Moss Free Clinic, starting in 2010 until now. He has a particular interest in helping patients to be empowered and in charge of their own health care. Dr. Neustatter is the author of Managing Your Doctor, a smart patient's guide to getting effective, affordable health care, which was published in September of 2015. He writes a monthly column for health section of the Freelance Star and the Medical Emancipated Patient for Front Porch Fredericksburg. I will put his contact information in the description where you can email Dr. Neustatter, and also know where you can find his book. You can find his book on Amazon. So thank you so much and welcome. We've had a family of people, some who joined during the actual live event and many who joined afterwards. So we want to just thank you so much. As I mentioned to you, in this whole, what we've been doing over the last 30 days is going through a journey of really helping women and their families to become more involved with their health care, to really know their health, to really research facilities, to make decisions about who they want to be as their provider, and to really begin to take control. What we know and what's written in terms of particularly people of color in the healthcare system is that oftentimes some of the outcomes that we have is that they're not listened to by providers. So I would really love to hear your inputs in regard to your thoughts about how can people become more involved? How can they really step up and feel like they can have an active role in what's going on with their healthcare?
All right. I should have given you the Reader's Digest version of my resume, obviously. And the other thing to say is, yeah, my interest is in helping people be empowered and take care of themselves and be involved. And, you know, I'm no great expert in prenatal care and, you know, pregnancy, but it's the same idea. It's the same principle as all the rest of medicine that, yes, you know, you can do a lot to help yourself to be empowered. And, you know, what you're saying, the most important thing is having information and knowing where to get information. And that's a real challenge in itself.
It is. I was trying to provide information particularly like when it comes to pregnancy and birth. A lot, birth got moved into the hospitals in the United States in the 1920s when there was the introduction of anesthesia. And so now we want to make birth a medical event, and it's been a medical event. And my idea is to try to help folks to know that this is a normal process, that there's more than one place to have a baby and do it in a healthy way.
When I was a student and we did the obstetrics rotation, I remember the sister saying that, this is the only place you're going to be in the hospital where it's a normal process that's taking place.
Yeah. So, so what I have been trying to do, I looked at your book a little bit, and you were able to try to help folks with trying to find out about their doctor, where they could go. I'd love to hear more about what you could offer in regard to that.
Yeah. Well, but the hideous reality these days is it so much depends on what your insurance is, and who they'll let you go and see, which is crazy. But otherwise, there's a lot of sort of, it's like everything. The more you research it, the better it is. But you want to find a doctor who sort of thinks the same as you and is culturally acceptable to you, and ideally, who'll talk to you like a human being. And the ideal is go and interview them. I don't know whether that may be an unrealistic idea in this day and age. And so often you finish up not with the doctor, you finish up with the extender, as they're so graciously called, with a nurse practitioner or a physician's assistant. And very often they can be just as good and more sort of compassionate and less hurried than the doctor themselves. But there's a lot, and the other thing I always say to people about finding a doctor is take note of the whole practice. If the receptionist is an ogre, I know that's their job to protect the doctor from the public, but you look at the whole setup.
So it's kind of like, how are you treated when you enter the door?
Yes, absolutely. I mean, doctors' offices are very different like that. You get a sort of feel as soon as you walk in, are you welcome, or are you just a problem for them?
Yes. So what tips would you give? I know for myself, I've worked mainly in like the city public hospital. And I feel, even though I was working with a Black population and I would say we did work with a lot of immigrant population, so lots of people of color, I still felt that there was difficulty for the patient to be able to speak up. You try as much as you can to kind of even the playing field where it's not so much power dynamics of, well, I'm the midwife and you're the patient, or I'm the doctor. Yeah. Can you give any ideas as to how patients can kind of break through that a bit?
Yeah, I know. I mean, that is a bit of a problem, and you do have to have a certain amount of sort of fortitude to stand up to your doctor or provider and ask questions, because they're always in a hurry. But I don't know, it's just, I think to show that you have an interest. I'd like patients that are interested in what's wrong with them, what's going on. So I think that I would say that was a key sort of behavior. But just and showing that you know about what's going on. Read about your pregnancy, know what's happening, know what the possible problems are. That will impress your doctor that you have an interest in it, and they'll be more encouraged to spend time and talk to you.
We had a group of dads on last week, and very interesting. We had one dad whose wife was a nurse practitioner, and he felt, well, she's the medical person, and he felt, okay, I'll let things be deferred to her. But then he decided, no, I want to learn more myself. I want to be more involved myself. And so he made the decision he was going to get more engaged, get more involved with that.
Yeah. Yeah. Well, the tradition is, that the dad's down at the pub getting drunk and, mum's giving birth. But,
yeah.
But for our first child, with my first wife, we did the Bradley method, which was meant to be this kind of super macrobiotic. I don't know if you know about it. And the woman's meant to get up off the delivery table and drink her orange juice and then walk back to her bed.
Mm-hmm.
Well, we finished up with my wife having a C-section, and the obstetrician telling me that it was hospital policy that I couldn't come into the delivery room. So it was like, even as a doctor, I was out-doctored.
Wow. How did that go for you?
Well, actually, in the end, he relented. And this was at the hospital where I'd done residency on Long Island, and I sort of knew the guy from that. So, but yeah, it was a sort of classic thing of how the rules can just impose all this craziness, and that's part of what we have to deal with: rules and regulations, and HIPAA, and insurance, and legislation, which complicates the life of the hospital and the provider and the doctor and the midwife.
So it's interesting to hear you are a health provider, and some of the obstacles you faced as being a health provider, trying to be there for your wife.
Yes. Well, and much more, later on when I'm in practice, the impediments to getting the care that your patients need are incredible. But it's all to do with insurance and money and, saving money. And I'm sure it's the same thing, all the people you're in contact with run into the same kind of restrictions, I guess.
True. We've talked, last night we talked a bit about trying to, I reviewed informed consent forms. Like, what does that really mean?
Mm-hmm. Mm-hmm.
I was shocked with one of the forms. This kind of came about with a friend of mine looking at the pre-admission consent forms for the hospital that she was going to. And as I reviewed them, I was like, oh my gosh, they're asking me to pretty much sign over everything and not
Mm-hmm.
really explain too much of anything to me.
Yeah.
So,
I know. Just going to a doctor's appointment is like a sort of, I don't know. You have to sign all these forms. It's crazy. It's really, it's sort of administration gone crazy.
Yeah.
But I guess that, I don't know that being an informed and, empowered patient can help that, unfortunately. But it can certainly help how you deal with all the practice as a whole and the hospital and the staff. I guess is be, tough and assertive, but nice.
Yes. That's the key, is the tough and the assertive, but nice. That's the thing. Interesting. I don't know if you were familiar with, this was the case of 2016 in Cedars-Sinai Hospital. This is I'm trying to remember the names, Johnson, I believe, where his wife went in for normal scheduled cesarean section. And during the surgery, the baby was delivered fine. During the surgery, with my reading, what happened was her bladder got cut.
Yeah.
And once she was out of the operating room, he noticed the Foley catheter. But his concern was, here he is, a Black man trying to get attention for his wife. And as you mentioned, how to be assertive but nice. And that was listening to him on the TV station that he was interviewed on. That was a thing that he was trying to bridge, was how can I get the attention but still not be seen as this angry Black man, but still needing to get the attention.
Yeah. Well, I guess that's not something I can relate to, but yeah, I guess the same principle applies, that, just sort of be the squeaky wheel, keep at it, but try and be as gracious as you can.
Yeah. We talked also last night in terms of preparing birth plans, that everything that's in this consent form, it's not in stone.
Yeah.
You
Yeah.
can, I don't know if you may want to talk to that a little bit.
I don't know. I'm forgetting. It's some book I read, and the guy was talking about some friend of his who went into the hospital and she had to sign all these agreements. And his advice was, don't sign this one that says you'll pay for anything that the insurance company doesn't pay for. And, sure enough, they confronted her with a huge bill, but she was able to get out of it because she'd crossed this out. But you've got to be sort of fairly kind of ballsy to do that. And sort of on the whole, I guess most people just sign the agreements and, hope that it doesn't cause them trouble.
I think you're overcome with the number of pages. That one consent form that I looked at last night, because they combine everything into the pre-admission form.
Yeah.
So it was not only the medical consents, and also you were consenting for anything that would happen to your baby when you signed that consent form, as well then of all the financial all the finances. Yeah. So it's all bundled into 14-page document.
Sounds crazy. I mean, I wonder if it would really stand up in court if you said that, there was no way that I could understand all of this and give a truly informed consent.
Yes.
But, I'm no lawyer. I shouldn't be speculating on stuff like that. But, I guess the advice is just sign the form.
So what would you make or suggest could be the best things you can do for yourself? We've talked a little bit about doing some research, trying to come in knowing. And for some people, it's somewhat of a steep curve to know more about their pregnancy, know more about what's happening. Yeah. But I'm wondering if you might have any hints or any tips that you may want to give to the audience.
Well, yeah, I have a whole chapter in Managing Your Doctor about getting information, how to get the right information and, and knowing where to go. I mean, in this day and age, we're mostly talking about the internet, but you have to be fairly selective and, careful about where you get your information and look for things that have a vested interest. If they're trying to sell something, they're probably not going to give you very objective information. Otherwise, yeah, just kind of know as much about what's going on as possible. And there is a lot of good information on the internet. So I think that's the way. The old days, you'd have to go to the library and look for textbooks and things, but information is much more accessible. But that is a problem in that, people get some weird ideas sometimes, and it takes much longer to tell somebody, explain why they've got it wrong than to tell them what's right in the first place. But yeah, I mean, getting information is something that's really worth working on, because that's the nitty gritty of what's going to make you, sort of a patient who can look after themselves, is to know what's going on, to be informed, to have that information.
So talking with you tonight, what it's seeming to be is taking some time to, when you go into a doctor's office or a new provider's office, is to start checking as soon as you walk in the door. Like, what's the atmosphere? What's the tone? Do I feel like I'm welcomed?
Yeah.
That as you're spending time with them, kind of, do they match with you culturally? And it's not only culturally, I mean, we could be from different cultures and still understand each other quite fine. Yeah. But are they, where are they with you? Are they able to relate? Are they going to take time? We know that it's not going to be, hours of time to sit down and talk, but where you feel that you're being treated like a person, that you're being treated like a human being.
One of the problems is that, the lack of choice. People are always asking me, in Fredericksburg, who should I go to? Who's a good doctor? And, there's very few people that are taking new patients and you can refer to.
Wow.
As I say, it depends on your insurance as well. So there's a lot of restrictions in, just having a free choice in who you go to. But still, it's still worth looking for somebody that you're compatible with.
Yes. And that is true, because each healthcare system has their own panel of providers. And depending on where you live, that provider might be with your company or not. The other thing you talked about was to really get involved with your healthcare, show the provider your interest, that you have some info. Of course, you're not going to have all the information, but you're coming to the visit with some information, and that you're interested, and that you're asking questions
Right.
that
Absolutely.
give the provider the impression that you have a little bit of sense as to what you're talking about.
Yep, absolutely.
And then the other is, let's see, I'm trying to think. The other is also understanding that because of how the healthcare system is set up now, that there's many barriers, even for those who are healthcare professionals, that they are dealing with, but that there are many barriers that you can or cannot do some things about. But in terms of speaking up, to do so in a way that, what shall I say? Diplomatic, is that the best way to say diplomatic without being nasty? Is that, I don't know, would you suggest that?
Yeah, well, being not being too intimidated to ask questions, but sort of do it as gently and graciously as you can.
Yeah.
And as I say, I think if you show you got an interest and you know a little bit about what you're talking about, then, pretty much any doctor would be happy to talk to you on a sort of more equal basis in that situation.
Well, I want to say thank you for these tips. I think it really helps having it coming from another healthcare provider, a physician who's providing services. It's good to hear the viewpoint of the provider. We can talk about the viewpoint from the patient perspective, but for them to know that the health providers want to talk with them, that, if you're showing it, that they do want to talk, not to just brush you aside. So,
yeah, I think that's generally true. But they do tend to be,
so thank you so much for your time. I'm sure that for anyone who's on with us, to feel free to provide any comments to us. I will leave information. You really do need to pick up Dr. Neustatter's book. I started looking through it last night. It's an easy read, but it is something that will help you. It does provide information on locations that you can go to get the information on particular doctors, how to research doctors, how to also research facilities to know about their safety records, and the recommendation to look at more than one recommendation. But
it's hard work being the perfect patient,
Yeah.
A lot of work.
But at the same time, it's necessary work if you're wanting to get the outcomes that you're hoping to get. So,
well, it's like so many things, it depends on how much effort you're willing to put into it.
Yes. So for those of us who have been on again tonight, I want to just say thank you. If you have enjoyed the conversation that we've had tonight, we'll ask you to like the page, to subscribe to my channel. As I say every night, if you need to share this with your mom, your dad, your sisters, your brothers, your aunties, your uncles, your cousins, your girlfriends, and those that you just meet. We want to say thank you so much for your time tonight with us. We really appreciate the insights that you've provided. I think it gives a good insight from the other side, from the side of the physician. And we just want to encourage those who are listening to know yourself, know yourself, get involved, take action. Thank you so much. Have a
Okay,
great,
well, my pleasure, my honor.
yes, yes. Thank you. Have a great evening, everyone.
Okay.
Thank you.